Hey everyone. So what we're going to talk about today is something that a lot of people probably would never have thought of day to day, and that's the position of your feet. Now, if you can stand up while you're watching this video, have a look down, just see where your feet are naturally placed. Just have a look at where your default position is, and then just see how that relates to your foot position when you're walking. What we often find is that the position that you stand in is probably a very good indication of the position that your feet will sort of look like when you're walking and moving around. And why is this important? Well, it's a very important aspect of normal function because the anatomy and the function of the lower half of the lower limbs are set up to function best in a certain shape. And what we find clinically, at least, is that the straighter your feet tend to be, the better. The way that your body loads up all of your lower leg with your feet straight seems to be a much more normalized pattern, which really decreases the risk of a whole range of foot, ankle, shin, knee, hip, and even lower back complaints. So, but the trick with this is basically a lot of people have never taken the time to look at where their feet point, and even if they have, they may not know what normal is. But if they are pointing out, if you are duck foot, if your feet do point out like a duck, it sets you up for a lot of the conditions that we see day to day in the lower half. So if you have any issues, if you have bunions, if you have flat feet, if you have navicular bone problems, plantar fasciitis, Achilles tendonitis or tendinopathy, shin splints, if you have any form of knee pain, if your hips impinge, if you have lower back pain just from day-to-day life, it's really important. It's really important to just take a moment to check this out on yourself. Because if you can, and we can get you to start correcting that, then you can start to normalize the function of those areas, and any exercises, whether it be mobility or strength work or any motor control exercises, balance, anything that you're doing is then going to have a much more significant effect, and it's going to last much longer, hopefully permanently, of course, because the environment that you then put it back into has been normalized. So, in an ideal world, if you're looking down, we want to see that your feet are relatively parallel. If you find that your feet are turned out, then we would consider this a duck foot or an externally rotated position. Now, again, for most people who walk around, if you're walking with your feet straight, obviously things look relatively linear. If you're more turned out, then it's still going to look the same, obviously. So why is this important? So basically, it all comes down to, or a lot of it comes down to what the arch of your foot does. So in a perfect world, with your foot straight, when you bend your ankle, in an ideal world, that arch shouldn't really change too much. We shouldn't see a lot of twisting, or as we sort of see, we shouldn't see that the whole leg collapse inwards and cause that arch to flatten. As that internally rotates, again, it just changes the dynamics of the foot and ankle. Everything's used to being loaded up in this linear shape, but then if we turn our foot out, we still need to move forward. So it's much easier to walk sort of through that big toe, through the instep of the foot, creating this collapsed shape. So in a perfect world, we should really be keeping everything nice and stable and walking through that sort of second to third toe. But as the foot turns out, we often end up walking through the big toe and sometimes more on the inside of the foot. Okay, so as you can hopefully see, when those feet are straight, normal mechanics are more likely to occur. So obviously if you have a stiff ankle, if you have other issues going on, your body is still going to try and find a way around that. But the idea is that just by simply trying to sort of re-engage with that position, we can cue the tissues in your entire leg to sort of feel more normal. So as with everything that we talk about in these videos, everything has to happen for a reason. So if you feel like, or if you look down and you see, wow, you are pointing those feet out, you are duck foot and you didn't realize, that has to come from somewhere. If anyone out there has kids who are walking around, 2-3 years of age, not many kids will walk around with their feet turned out. Most kids are pretty straightforward, and at least from my experience, a lot of what we see clinically, there's two factors that generally sort of force kids and force us to eventually end up down this path of turning our feet out when we walk and when we stand. The first one is basically footwear. So we tend to live in a modern world now where most of our shoes have a heel on the back. There's some obvious reasons why we do that in terms of performance and running and cushioning and all this sort of stuff. But what that does mechanically is the size of the heel on your shoe directly relates to the amount of ankle range of motion you don't get access to. So if you're in a shoe doesn't matter how, if it's a full heel or whether it's just a men's business shoe, that matters because you don't get access to that ankle range for the entire time that you're wearing that shoe. And if you wear that shoe often, then over time, it becomes really easy for you to lose access to that range. It becomes stiff. Now, what happens is, as a lot of people realize who follow our content, is that if you're missing something, your body generally has to compensate for that in some way. And one of those compensations is turning your feet out. So you can test this out for yourself. I don't think this shows up very well in the video, but if you stand up and squat down, what you might find is that as you start to reach the depths of your ankle flexibility, you might feel like your toes and your feet start to point out a little bit more. So all that is a compensation that your body is adopting to achieve the task, but it sacrifices the function in order to do that. So that's the first thing. So if your ankles are stiff, again, most likely through heeled shoes, you can get it through flip-flops or thongs, depending on where in the world you're from. But the point being is that a lack of ankle range forces your body to find a workaround. And if you're in that position a lot, it just gets used to it and it becomes the new normal. So the second part of the equation that we see a lot is as we travel further up the leg towards the hips, because we live in an age where sitting is a common occurrence now, we're often stuck in that sort of 90 degree position where our hips are bent and then our ankles are bent and we're stuck in that shape. So same idea as the ankle, if you're stuck sitting in a similar position all the time with the hips bent, that becomes stiff, it becomes tight. If you're not using the full range, we tend to lose it. So our hips get stiff in that area. So the tissues at the front of the hips become quite tight because they're stuck in that 90 degree position a lot. And then when we try and stand up out of that position and extend our hip when we're walking, the leg can't extend back in a linear motion, so it then has to work around something to achieve the same result. So instead of being able to extend our hip fully with our foot straight, it's much easier to turn your foot out and work around that tightness to allow you to keep doing what you need to do. So we've sacrificed the technique of skilled human movements for just getting the job done. And again, without any of those variables changing, it's very hard for those feet to stop pointing out without realizing. So I guess the main idea with this is stand up, take your shoes off, look down, see where your feet naturally position themselves. When you're walking, get a sense of the same thing. If you have any dysfunction in your legs, it may have a bearing on that dysfunction. But even if you don't, and you just want to perform better, if you're an athlete that runs, if you jump, if you value anything athletic, it's much better for you to try and sort of straighten up those feet, to improve the function of your legs, the function of your lower limbs, so that you can generate more power, more strength, maybe you don't fatigue as quickly, all because of the direction of your feet. So if you do feel like your feet turn out, or you do see that they turn out, we have some videos coming out in regards to certain stretches to help those things. So to help ankle flexibility, help that stiffness at the front of the hip, the tightness at the front of the hip. But what you can do today to try and get those sorts of things to straighten up is consciously make the effort to straighten yourself up. See how that goes. Again, it will feel like you're a bit awkward. You may feel like you certainly turned in too far to begin with. But that's just because your body's perception of what normal is has shifted. So instead of it being relatively straight, it feels normal is now out a little bit. So when you turn those feet back in again, you're actually telling your brain that it's more inwards. But it's beside the point. But the idea basically is that if you can just consciously try and remember to keep pointing your feet straight when you're walking and when you're standing, it can go a long way to solving your lower leg dysfunction. It's that important. So as always, please consider subscribing to the channel. Please leave a like. If you have any questions, let us know. I'm always interested to know, and we're always interested to know, in what direction do your feet point, and whether you feel like it's natural or not, because there's a big discussion we can have in regards to what is normal and what isn't. But functionally, we know that the position of your feet matters, and more often than not, the straighter your feet are, the better you are. The more athletic it is, the more access to your full athletic potential you have. So, so again, let us know how you're going, and we'll see you next time. Bye.